Hello everyone. I am Dr. Gaurav Mandhan from Miracles Apollo Cradle. I am a senior consultant and head of the department at Department of Pediatrics and Neonatology at Apollo Cradle Hospital, Sector 14. Today we are here to discuss a very important topic about rickets. मेरे ख्याल से सब लोगों ने सुना होगा इस बीमारी के बारे में. पुराने ज़माने में इस बीमारी को in ancient times we used to call it as bone deforming disease actually. We'll discuss about how it happens and how common it is in India. If you see the Western countries, the incidence of this disease is around 2 to 3 cases per 1 lakh kids who are born in the USA or in the Australia, New Zealand. However, in India, because of malnutrition, the incidence of this disease is actually very high, and maybe after the initiation of routine supplementation of vitamin D, the incidence has declined a bit. But if you see the areas, peripheral areas where the doctors and facilities are not available, routine supplementation is not there, still the incidence of rickets still remains very high. Let us talk about how it occurs. So usually we need vitamin D for our routine functioning of the body, and for the bone health vitamin D is a very essential. So most common cause of rickets in children is vitamin D deficiency. So how this vitamin D deficiency occurs nowadays? आप देखते हैं कि we don't go to the sunlight and kids keep on playing only the indoor games. And even the mothers during the delivery also, the mothers are also deficient in vitamin D, and these are all the factors which are actually responsible for vitamin D deficiency in children. Hence nowadays we have a routine practice of supplementing vitamin D around 800 units, 400 to 800 units per day, and this is continued till around 2 years of age. And this routine supplementation has drastically reduced the incidence of rickets in past 10 years. How we come to know that your child is having rickets? तो सबसे पहले आप देखेंगे this rickets is a disease of developing or growing bones. So once your child starts crawling or child starts standing, this is a time when you come to know that your child may be having some deformity of the bones, some soft bones, and there might be some widening of the wrist or widening of the ankles, which might be seen, and there might be some bowing of the legs. So these are the typical features, and along with that there might be bone pains, kids might stay irritable, there might be poor growth, a failure to gain both height as well as weight, and there might be many deformities, means your bones hain, they can deform, like they can have some deformities which usually if happens requires later on orthopedic referral. So the first thing I'll talk about is prevention. So we do prevent the vitamin D with the routine supplementation, rickets with a routine supplementation of vitamin D, which we are doing till 2 years of age. And in case your child has a rickets, the child you should screen your child at each vaccination routine visits for the presence of rickets, and doctor should be taking a proper history whether the mother is able to give or mother is compliant in giving the vitamin D on daily basis or not. Once the child develop rickets, and if you detect it clinically, we do some clinical tests for blood investigations as well as some x-rays to confirm the diagnosis of rickets, following which some clinical tests for blood investigations as well as some x-rays to confirm the diagnosis of rickets. The treatment with vitamin D as well as calcium supplementation is usually started. If the deformities have not started, this rickets is a treatable condition, and usually we don't require any surgical or orthopedic interference. However, in case the deformities have already set in and we are late in diagnosis, we usually require orthopedic surgeon referral, and the kids might require some sort of surgery to correct the bony deformities. So there are two types of rickets which are available. One rickets is only dependent upon vitamin D status of the kid, and other one is some genetic forms of rickets are also available. So in case any child who fails to respond to vitamin D status, vitamin D therapy, we do see or look for genetic forms of vitamin D in those kids. So this is just about a brief about the rickets, and in case you have any further doubts, if you have any doubts regarding the vitamin D supplementation of the in kids, kindly refer to our website of miracleshealthcare.com. You can visit our Facebook page also. Please feel free to contact in case of any further doubts. Thank you very much.